Hi there, everyone. I'm your host, Heather Lee, and welcome to this latest episode of Medically Speaking. Joining me today is Dr. Roberto Pili, who is the VP of Oncology Services for Kaleida Health. Thank you for being here.
It's a pleasure to be here, Heather. Thank you.
So let's dive into your background. How long have you been practicing medicine for, and what drew you into oncology services?
Well, I've been many years, as a matter of fact. I grew up in Rome, in Italy, and then I came to the States to do research, and then I did all my training and eventually end up to be an oncologist. But taking care of cancer patients has always been my dream, and I live this profession like a mission. So it's really have a lot of proud, but it's an humbling profession. So
Very humbling.
Very humbling. So, and we learn every day. So.
Yeah.
From our patients.
Exactly. And we're going to talk a little bit more about some of your research in a little bit. But first, when folks think of cancer care, sometimes they don't always think of Kaleida Health. Why should somebody come to Kaleida for their care?
Well, Kaleida, of course, has a big presence in the medical field here in Western New York, not just in Buffalo. And cancer care is part of Kaleida.
A growing part of Kaleida.
A growing part of Kaleida, and I think I came here 5 years ago to build and grow this program. And this is really a partnership. And a strong partnership, of course, with the University of Buffalo and the UBMD. So with Kaleida, really, we've been able to consolidate and grow this program, both on the medical oncology and the surgical oncology. And so we believe that we are in the position now really to take a great care of our patients that deserve the highest possible care and compassionate care. So
I think that's one of the key points there, right, is the compassion. Also, what does a partnership, with UBMD, for example, what does that mean for patients in what we can offer them in terms of the services, the depth of knowledge, the number of providers, and those specialties?
A very, very good point. I think it has been really a strategic partnership that Kaleida has, not just in oncology, but also in other fields, but for oncology in particular, because it does bring that depth in expertise. Many of us are involved in lab research or clinical research. And so have access to clinical trials. I think that's very important and is part of really of outstanding cancer care. So again, I think this partnership has been critical, and we're very excited to continue this in the future.
And I feel like over the past several years, there have been more clinical trials that we've been able to offer to patients, again, because of that collaboration. Are there any that come to mind, or any advancements that come to mind that you're particularly proud of and want people to know about?
Well, our strong interest is actually in nutrition and diet. So we do actually have 3 and hopefully in the next few months, 4 clinical trials that we offer to our patient, where we offer dietary restriction. We believe, like many others, the calorie restriction and some type of fasting and plant-based diet can help our cancer patient not only to have less side effect from chemotherapy, for example, but increase also the efficacy of our treatment, in particularly immunotherapy or monotherapy for prostate cancer. So we're very excited about that.
And if I understand correctly, you have some folks that are in that right now, right?
Yes, these studies are open and accruing. We have almost completed the first studies, about 30 patients, where we offer calorie restriction and plant-based diet. Again, these are open to any type of cancer and to any type of chemotherapy. And let me tell you, our preliminary observation are pretty astonishing. These patients, some of these patients really have a much less side effect from chemotherapy by just fasting before each cycle of chemotherapy.
So it's basically how the diet can make the medicine more effective.
Absolutely.
But also reduce.
This saying food is medicine. I truly believe, and I think is really having healthy lifestyle, not smoking, not drinking, but having a healthy diet. And sometimes do some calorie restriction might actually help these patients. So.
that sort of taps into the screening, the prevention, the early detection. What is your message to folks out there, no matter what the type of cancer? What can we all be doing to take our health into our hands and hopefully either prevent things the best we can, or if you get a diagnosis, to put us on the right course to making us the healthiest?
Absolutely. I mean, of course, the prevention should be our goal, and we don't do enough. Unfortunately, the resources are limited. Work with your primary care physician that is in the front line to really offer that type of screening opportunity. But as a Kaleida Cancer Care, we're really implementing with Glenn screening opportunities in breast cancer, colon cancer. We do early detection in high-risk patient prostate cancer, opening a lung screening program, a screening program for lung cancer. So I think these all initiatives are very important, especially for our inner city patient population.
Absolutely.
Who has a less access to care. And we do see this difference since we're serving, for example, Buffalo General, suburban, the different patient population that are there. So the needs are different. So screening is a top priority for our program.
Absolutely. And in marginalized communities, we often see higher rates of disease. But there's also, on some levels, some mistrust with healthcare providers. What can you do to sort of help break down those barriers so that people feel comfortable and they're not scared or they're not apprehensive about getting a screening or coming for healthcare?
You touch a very important issue. We have, again, through Glenn, but also through our division at UB, we established an outreach program, working with the churches in the communities, and to make this opportunity about screening an important aspect of daily life for this patient population here in the inner city. So we're trying to bridge that gap. It's not easy.
It's going to take time.
It's going to take time, but I think Kaleida is really in the best position to address these needs, and we're all working for the same goals. Yeah.
There is a patient that I work with who was diagnosed with prostate cancer, and after his diagnosis, took it upon himself to go out into the community and basically scream it from the rooftops. You need to get screened. This affects us. Right. This is important. When you hear stories like that, I would imagine as a provider that makes you smile and makes you feel like you're starting to crack the surface of that.
Absolutely. And we all have a story like that we're making difference there in the community. There is a long way to go, but that's really a priority.
Yeah. One of our priorities at Kaleida is sort of having that one-stop shop, if you will, when it comes to cancer care and perhaps some of the treatments that might be around it. If patients need blood work, infusion services, perhaps emergency services, we're able to provide that, which not everybody is.
Absolutely. And I think we're very excited about the new infusion clinic we opened early this year. We have a multidisciplinary clinic at Buffalo General across the infusion clinic. And we are really positioned, like you said, to have a really one-stop where patient can get all the cares they need in one location. So we're very excited about that, and there is a great opportunity to grow. So, but we're definitely in a better position now than a few years ago.
And with having the infusion center, the new infusion center at Buffalo General Medical Center, that also removes one of those barriers because let's say somebody lives in the city of Buffalo.
Absolutely. They can just walk. I mean, I have some patient I do have in my clinic at the D1 here at Buffalo General, and I have a patient that just walk. And so that's amazing.
Yeah. They don't have to travel to the suburbs.
They don't have to travel.
Yeah. Which makes it very, very convenient. We talked about your research involving nutrition. Any other research or clinical trials that might be on the horizon that you're excited about?
Well, we are, thanks to Kaleida's support, we have a clinical research infrastructure. And so our goal is really to try to bring clinical trials for the biggest disease like prostate cancer, lung cancer, breast cancer, colon cancer. And in the future, we're going to be able to bring also cellular therapies, these new treatment that are on the horizon for many solid tumors. So again, we're very excited to be able. We're about to open here about for general opportunity for prostate cancer to get a new compound that delivers radiation directly to the cancer cells. So again, there are more treatment coming up, more clinical trials opportunities. We're very excited.
And with that more directed radiation, what does that mean for a patient, for their outlook, for their recovery time, in their healing process?
Yeah, I mean, the future for cancer therapeutics is in this, we call it drug conjugate. These are antibody warheads that recognize directly cancer cells, and so they can deliver chemotherapy, for example, or radiation. And so the side effect of radiation chemotherapy are much less because it's a much more targeted therapy. So again, we're very excited to be able to provide this type of treatment to our patients.
And in recently talking with one of your colleagues, he was explaining that with prostate cancer, these days it's not automatically go in doing very aggressive surgeries. Sometimes there's a watch and wait approach.
Watch and wait. Especially, yes, in prostate cancer, 1/3 of the patient with early diagnosis of prostate cancer are candidate, what we call it for this, is not just forget about it, but it's called active surveillance. So these patients monitor routinely, but those are the patients that actually we can offer and over the next few weeks, actually opportunity for diet and intervention. And I truly believe that changing the diet, changing the exercise can actually have impact in early disease, especially disease like prostate cancer.
And that goes back to the prevention that we were talking about a little bit earlier. You also, one of your specialties is bladder cancer. Mm-hmm. What should we know about bladder cancer, the risks that lead to it, and again, what we can do to take our health into our own hands? Yeah,
absolutely. There are unfortunately still too many people who are smoking. So I think a smoking cessation program is something that I know Kaleida is very involved in that. Working with a primary care physician, a general physician is very important. So I think I would love it to go to the school, to the kids in the schools and talk about how bad is vaping, is as bad as smoking, if you want to live a healthy life. So for bladder cancer, on the other side, there has been a great advancement with immunotherapy. Nowadays, we can really treat very effectively, even a more advanced stage of bladder cancer. But as you said, prevention is the key. So we need to have less people smoking here in Western New York.
I think of mammograms for breast cancer, colonoscopies for colon cancer, and prostate exams. But for some of the other cancers, are there necessarily screenings that we can do, or what are the real proactive measures, I should say, that we can take to try to detect it early?
Yeah, again, family history is important. If you have many cases of cancer in your family, that is a sign you need to get attention, and you need to get screened, even for some relatively rare disease. So there are opportunities there. But as you mentioned, for colon cancer, prostate cancer, lung cancer, and breast cancer, there are screening tools available. Just ask your primary care physician. Don't be shy.
I used to be one of those people that, was afraid to go to the doctor because I was anxious about what I was going to find out, what they were going to tell me.
Right.
But then I think about it, if you don't go and you learn something down the line, right, and it's, a not so great diagnosis, you don't want to be told, well, you should have been here 10 years ago. What is your message to people who maybe are a little bit apprehensive about the screenings, going through the actual process, or just think that they don't have to worry about it? What would your message be?
Take ownership of your body and, on your health. That's the message. And part of seeing your primary care physician on a regular basis. And if there is a cancer in the family, if you're at risk for cancer because you've been smoking for a long time, ask for screening opportunities. Don't be afraid, because the screening might be negative, but you need to continue to check regularly. So it's important. So and hopefully we can try to educate our kids to be more aware about this.
Yeah. And I understand you're growing your GI team soon?
There is an opportunity for the GI teams with Dr. Guidos as a surgical oncologist coming full-time at Kaleida. As you know, he's a really national expert in hepatobiliary tumors. They do high-risk surgery here about for general for this type of disease. So, and we are bringing actually more medical oncology with expertise in GI cancer. So we're very excited that we can offer even more opportunities to our patients.
And it's right here in Buffalo. It's right in our backyard. What does that mean for a patient's, not only their physical well-being, but mentally, not having to travel anywhere to get cancer care, being perhaps able to still work, being close to family? That seems like it's all part of the prescription as well.
Absolutely. And again, our team have the expertise to treat any type of cancer. And of course, we are part of a larger network, so we have access to other medical centers or any cancer center. So it is not just a silos. We follow all this, we call it NCCN guidelines, the National Comprehensive Cancer Network guidelines. So again, patients do not need to travel. If for some reason there needs to be travel, we are going to be the first people to advocate for that, and we're going to take care of that.
Yeah, we got some of the best right here at Kaleida Health.
Absolutely.
All right. Dr. Roberto Pili, VP of Oncology Services for Kaleida Health. I really enjoyed our conversation. A lot of really great information, a lot of important information.
A lot of important. We talked about a lot of important things. So, but it was a pleasure, and Heather, thank you for giving me the opportunity to.
Yeah, and as you have more and exciting things
we'll
happening,
come back.
Yes, we will be back for sure.
We'll be back.
All right. Thanks for watching. Thanks for listening, and we will see you next time right here on Medically Speaking.